All right, welcome back here on Live Impact News on WCNC Plus. I'm Nick Sturdivant. Jeb is here in studio. So we talked about this earlier, and we played about 5 to 10 minutes of this. This is a press conference from a few hours ago, and basically President Trump made the announcement regarding the impact. And let me read you sort of the headline to kind of give you a better summation of this. But Trump promotes unproven ties between Tylenol vaccines and autism without new evidence. I'm reading that headline from AP News. Again, he actually teased this announcement over the weekend. But again, this is something that and Health Secretary Robert F. Kennedy Jr. has been talking about this for years and within his administration since the very beginning of this second administration. But again, President Donald Trump today promoted unproven ties between Tylenol vaccines and autism without offering new medical evidence. I want to bring in David Laxton. He's with the Autism Society of North Carolina. David, thank you for joining us here on Live Impact News.
You're welcome. Thanks for the opportunity to speak with you about this.
Let's get right to it. So President Trump, speaking at the White House, Trump said women should not take basically Tylenol. He mentioned the active ingredient Tylenol, but we know it as Tylenol
Yes.
during an entire pregnancy. When you hear that and you hear the link to autism that he's making, along with Health Secretary Robert F. Kennedy Jr. making that link, I want to get your reaction to that. What comes to mind?
Well, I think that some of the information that they talked about today, or some of the things that they discussed, uh, those concerns have been around, whether you're talking about autism or not. There's fine print on all the things that we take, and it recommends, you don't want to you don't want to take more than you need to, and you need to talk with your medical provider if you're going to put anything into your body or your child's body. So yes, they're talking about this, and they alluded to some studies that are out there, and there are lots of research organizations that have put statements out there about whether or not those studies are you know too narrow, or not enough has been done to prove it. But from our standpoint, I think that the main thing is you want to make sure that you're having conversations with your doctor, whether you're an expecting mother or whether you're parents and you have a young child. One of the things that we've always talked with families who reach out to our organization for help, or they have questions about, my child, I'm not sure if the doctor knows enough about autism, then we share information with them that they can pass along to their physician. One of the things that they also talked about today during the press conference was they talked about spacing out some of the shots that kids get, and that's something that has been a question within the autism community for a while too. And we've always looked at it from a standpoint of, if you have questions, you need to talk to your healthcare provider. That's what they go to school for. That's what they're trained for. You want them to know your concerns. They want them to know. You want them to know what is going on with you and with your child, and you want to be able to have a good relationship with them so that you can figure out the best plan of action. So it wasn't as groundbreaking as what it might have been promoted as. But again, I think that there's going to be a lot of discussion around that, and they've pledged to be transparent about it. So we will see what the next few weeks and months and years bring forward on this. It's going to be interesting.
Yeah, and then beyond this announcement, again, they've been talking about this sort of link for months,
Mhm.
suggesting it at least. Has it impacted the way you guys operate and the information that you guys get out to families? I know your biggest advice is go to a medical professional, but has it impacted you at all?
No, I mean, we've always been there. Our organization's over 55 years old now, and it was founded by parents and professionals working together. And part of our philosophy has always been for parents and professionals, whether it be a medical professional or some other type of person who's working with your child, to have a good working relationship, a good dialogue about your concerns, about the questions that you have around what you're doing for yourself, if you're a person with autism, but then also from a parent standpoint, they need to be part of the dialogue, because it's not just the parents that are raising their child. They've got folks working with them. So whether it's a teacher, whether it's a dentist, whether it's the doctor, whether it's a therapist, you all want to be on the same page about what's going to work best for that child. And again, recommendations around how much Tylenol you should or should not take, or acetaminophen, I think is what they were trying to say at one point in time today. But then also these other things that they discussed. Again, we've always said, have those conversations, express your concerns, try to get answers, and share good information. And that's ultimately going to be a decision that's up to you. But you want to be informed, and you want to be armed with good information whenever you go into those decision-making situations with providers. And we're here to help both the parents and the professionals with that, by helping to give them information and training about signs and symptoms of autism if they happen to be a healthcare provider. So we think that overall, our state has a higher level of understanding in the medical community of what some of the signs and symptoms are. So now we think that we hope that there'll be continued discussions about what's the best thing to do, and timing for some of these issues that they brought up today.
This announcement aside, how do you go about, we live in a world where somebody can say something on social media and people take it as facts.
Yes.
How do you go about getting out that good information, as you said, and that much needed information for families?
Yeah, it's challenging. I mean, one, we appreciate the opportunity to be talking with you right now and sharing information. Like I said, we've been doing this, and we've been a lifelong partner, really, for individuals with autism and their families for decades now. And in North Carolina, there are a lot of organizations that have worked together to support the autism community. So we want to make sure that people have easy access to information. We have a resource database that has all different types of information that we share with families, that we share with individuals whenever they contact one of our autism resource specialists. So we've always tried to maintain that information, and within our organization share it so that everybody knows not only how you might be able to answer a question that we have the answer to, but then also know what we don't know. And that's whenever we point people to other folks that might be experts. So we have printed information that we share out. We have a website that's really robust, and it has both information that's based on what other organizations and researchers have put out there, but then it also points to those organizations as well. So we just try to do the hard work of rolling up our sleeves every day and continuing to make sure people have good information. And they reach out to us via email, via the phone, through the website. We're on social media too. So it's hard to keep up with how fast some of the information travels nowadays. But we also are trying to be proactive in pushing out that good information, and pushing out information about what's happening with the autism community on a monthly basis, or more frequently if needed. So we hope people will reach out to us if they have questions, because we do want them to get good information. And not everything that happens or occurs on the internet is true and based on fact. So we always say, trust but verify, and we're more than happy to be that trusted partner and help you verify information.
Yeah, David, as you mentioned, you guys work hard to get out that information and work hard all around. North Carolina is a big state.
It is.
So I do want to ask, what's the best way for folks to get in contact with you? I ask that because, again, this is a big topic, and there are a lot of questions that we can't necessarily fit into this interview. But
exactly. I would say the best place to start, where you can do a lot of digging and spend a lot of time, is our website. It's www.autismsociety-nc.org. If you want to talk to somebody, excuse me, if you want to talk to somebody, you can call us toll free at 800-442-2762. That's toll free statewide. And we do serve all 100 counties. We've got autism resource specialists who can give you just a ton of information. They're also parents of individuals with autism as well. So they've not only had some experience dealing with all the different things that come up, but also experience in seeing success and growth in their children, their loved ones with autism. And it doesn't matter whether you're someone who wonders if your child might have autism, you have somebody in your family with autism, or if you're an individual with autism, we're a lifelong partner for all of the above. So again, our website at autismsociety-nc.org is probably the best place to start. And we're happy to help, and we're not going anywhere. So people can reach out to us, contact us with questions. We'll be happy to help them.
You heard it here first, folks. They're not going anywhere. That is David Laxton with Autism Society of North Carolina. David, thank you for your time. Feel free to come back here on Live Impact News. Again, this is a discussion that will continue, so we welcome you back here on Live Impact News anytime.
I appreciate it, and I look forward to speaking with you again in the future.
All right. Thank you, David. In case you missed this interview, just now tuning in, you can catch the interview. It'll be on our digital platform shortly. Our digital team works hard as well. So the interview will be up there. Our full interview will be up there on our digital platforms, on our website, on YouTube, you name it, shortly. All right. Let's take a quick break. We'll be back here in 2 minutes on Live Impact News on WCNC Plus.